As Uganda joins the world to celebrate the International Childhood Cancer Day, Uganda Cancer Institute expresses worries towards the increasing cancer cases among children every year. 80% of the 300,000 children living in low-middle-income countries like Uganda suffer dangerous diseases like cancers. During a media briefing in Kampala, Dr. Joyce Balagadde Kambugu, the head of pediatric oncology at the Cancer Institute, says the cancers have increased due to various challenges like the COVID-19 pandemic that hit the country, that so many children failed to even get treatment, while others could not get tested due to travel challenges due to the lockdown, among others, as she explains.
COVID-19 has been a big problem, the pandemic, in the past year, since last year around February in Uganda. Whereas children have not been directly, death among the children as compared to the adults has not been as much. Children have actually been affected indirectly, and that is what has contributed to the poor performance, perhaps in terms of treatment and presentation to treatment centers. Children have been affected indirectly. Children are dependent upon their parents and their guardians to come to cancer treatment centers and to adhere to their appointments whenever they're supposed to come, because children don't work. Children are minors, they can't take taxis.
But what are the symptoms of childhood cancers in Uganda, and what are the causes of such deadly diseases in children? Dr. Mugisha Nowe does explain some of such causes, like continuous fevers, swellings, among others.
One of the potential causes of unwellness can be cancer. Now that applies in adults, but many adulthood cancers have, typical signs and symptoms that you can tell somebody that when you see this and this and this, think of this cancer. For children, that doesn't apply. But I want to say that for children, the signs of cancer can include, one, swellings, and I guess many people know that, actually many people think every swelling is cancer, which is definitely not true, because we have many swellings on our bodies that are not necessarily cancer. But in children, cancer can show itself in the form of a swelling. It can be fever. It can be loss of milestones.
But Mugisha explains further that such cancers in children are easily treated if diagnosed early, but do kill children early enough than adults, putting it at a dangerous position in killer diseases for children in sub-Saharan Africa.
Cancers in children are much easier to treat than cancers in adults. Another way to put it is that many people who suffer from childhood cancers survive compared to many people who suffer from cancers in adulthood. And that's why the theme this year is, it is through our hands that we can achieve better survival of children who suffer from cancer, because each one of us has a role they can play. I also want to emphasize again that cancers in children progress much faster. What I mean is that if you have a 50-year-old man develop cancer today, and a 5-year-old boy develop cancer today, the child is going to die before the man.
However, Dr. Joyce Balagadde also urged government to have a UNEB examination center at the Cancer Institute to allow cancer patients, especially children, to allow them sit examinations as a way of not losing a year due to this deadly disease.
Sometimes a little bit more than a year. And we expect that they will be cured and go back. But a lot of our children here from upcountry and even within Kampala are getting out of school for the duration of treatment, because if they were in school in Masaka and they're in Kampala, they can't study. For the whole year that they are here, they are out of school and they have to repeat classes. Some of them are in candidate classes, they won't be able to do the exams. So one of the things we are advocating for with our line ministries is the Ministry of Education and Sports hosting here at the Uganda Cancer Institute teachers, so that the children who are in school can continue with their education even while they're here. This is what happens in other countries. And having a UNEB center, say PLE.
Children, unlike adults, have the ability to handle the consumption of large amounts of chemotherapy and suffer few side effects like stigma, among others. Brian Senkumba, Channel 44 Prime News.